Hello, my name is Dana McCormack and I'll be demonstrating a Foley catheter insertion. So I have an order here. It is for nursing Jake, FIN 312-654-987, and date of birth January 1st, 1960. The order is for February 7th, 2021, and it is to insert Foley catheter now to monitor fluid balance closely, and that was double signed. So I'm going to put that aside. I'm going to get my supplies, wash my hands. Pericare has already been completed, so I do have a drainage bag with tubing, sterile gloves, a 14 French catheter with a 10 cc balloon, as well as my sterile Foley kit. So I get my supplies, put it on a cleaned table, do my entrance safety check, wash my hands, and introduce myself. Hello, my name is Dana McCormack. I'll be your student nurse for today. Is it okay if I check your wristband? Good. And can you tell me your full name and your date of birth? Good. So nursing Jake, January 1st, 1960, FIN 312-654-987. Good. So Jake, I do have an order to insert a Foley catheter. The reason is to monitor your intake and output closely. So the procedure would be a sterile tubing would be inserted through your urethra and into your bladder and held there with a balloon, and your urine would drain into a bag. Is that okay with you? Yeah? Do you have any questions? No? Okay, good. So the curtain would be drawn. Again, pericare has been completed. I have a blue pad underneath the patient's legs, as well as their legs slightly abducted. And the table, the bed, would be above waist height, as well as my bedside table. And again, pericare has been completed. So I'm going to wash my hands and set up my drainage bag. So I would attach this to a non-moving part of the bed, and I'm going to clip this on the bed sheets close to the patient's waist. So the patient is exposed. I'm going to wash my hands and get my sterile kit ready. So being careful to only touch the 1-inch border. I'm going to place this drape on top of the blue absorbent pad, being careful to only touch the 1-inch border. And do the same with the fenestrated drape and place it over the genitalia. I'm going to pass myself the garbage bag and place it in between the patient's legs. And I will open my catheter using the butterfly technique and using the sterile forceps, place the catheter into the boat. Okay, and I just want to mention, in an ideal situation, I would not have my back to either of my sterile fields as well. Everything would be above my waist height. Unfortunately, this is not possible. But moving forward, I'm going to wash my hands and I'm going to put on my sterile gloves. Again, being careful to only touch the 1-inch border. On the left first, remaining sterility. So now that my hands are both sterile, I can fix my gloves here. And my hands are sterile, like I said, so sterile to sterile. I'm going to take out the catheter and place it into my boat. I'm going to open the povidone wipes remove the cap from the syringe and attach it to my catheter, making sure this is 10 cc's and as well this is 10 cc's. Then I will lubricate using petroleum jelly the tip of the catheter 6 to 8 inches because this is a male patient. So that was 6 to 8 inches. Now that I have everything ready in my boat, I will bring it to sit in between the patient's legs. Okay, so now I'm going to grab the shaft of the penis and retract the foreskin and clean from the meatus down the glands using the povidone swabs. My left hand is no longer sterile, but my right hand will remain sterile. Out. Okay, Jake, I'm going to get you to bear down as if you're about to void and take a couple deep breaths. I'm going to insert the catheter now. Good. So being sure not to touch the tip of the penis, I'm going to insert 6 to 8 inches. I do see urine flowing, so I'm going to go another inch. I'm going to stabilize and inflate the balloon with the 10 cc's of sterile water. I'll give a gentle tug to make sure that the balloon is inside the bladder, which it is, and I'm going to remove the syringe and attach the catheter to the boat. My hands are no longer sterile, so I'll remove the cap of the tubing from the drainage bag, attach it to my Foley, remaining sterility. Okay, I would attach this to my leg, the patient's leg, make sure the foreskin is placed back. I would remove all of my supplies, complete peri-care, remove my gloves, wash my hands, lower the bed, make sure the call bell is in reach, and make sure there's no kinks in the tubing, and then I will do my exit safety check, and then I will document. So the catheter was inserted to monitor intake and output of urine closely. Consent was given. The patient tolerated well. It was a 14 French catheter inserted with 10 cc's of sterile water in the balloon. It was inserted on one attempt with ease. 100 milliliters of urine, clear amber urine, was drained from the bladder. Peri-care was completed. It was a sterile technique procedure, and an intake and output record has been started. Again, peri-care was completed. So now I have an order to remove the catheter. So I would review the order, get my supplies, so blue pad, clean gloves, and a sterile 10 cc syringe. I would enter my room, do my entrance safety check, bring my supplies with me. Peri-care was already completed. I would introduce myself, wash my hands. Hello, my name is MCCormac and I'm a student nurse. Can I see your wristband? Good, and can you tell me your full name and date of birth? Good, so nursing Jake, January 1st, 1960, good. So Jake, today I am removing the Foley catheter because we no longer need to monitor your intake and output closely. Is that okay with you? Yeah, do you have any questions? No? Okay, so just to let you know the procedure, I would be removing the fluid that's inside the balloon and removing the catheter, and then you'll be able to void on your own. Okay, so the curtain would be closed. I would wash my hands and put on clean gloves. The drainage bag has been drained. There was 400 milliliters of clear amber urine, which was documented on the intake and output record. There's a blue absorbent pad under the patient. Again, I've washed my hands, I have clean gloves on now. And I'm going to get a sterile syringe. Again, pericare was completed. So we'll attach it to the hub and let the 10 cc's of sterile water drain from the balloon. Okay, I'm being clear here, there's 10 cc's removed. So I will throw that out. And Jake, can I get you to take a couple deep breaths out for me? And bear down as if you're avoiding. Good. So the catheter is removed, the tip is intact. There are no pieces missing, there's no blood on the catheter. This whole system can be thrown out. There's no sediment in the bag. So this can all be thrown out. So I would remove all my supplies, complete pericare, remove my gloves, wash my hands, make sure the bed is low, the patient is safe and covered, and the call bell is in reach. Pericare is completed, and I would do my exit safety check, so the bed is low, the call bell is in reach, good, and I would document. So the reason for removal was that we did not need to monitor the intake and output as closely anymore. 400 milliliters of clear amber urine was removed from the drainage bag. It was a 14 French catheter. 10 cc's of sterile water was removed. The tip is intact. There's no blood. It was removed with ease, and the patient tolerated well. And I will continue the intake and output record and monitor the patient as they are to void within 8 hours. And yeah.